Zone Board meeting on January 18th to order. And I'm going to ask Ms. Hodge to do roll call for us.
Mr. Breitling,
Here.
Mr. Steen,
Here.
Ms. Fry, Mr. Hagan,
Here.
Ms. Haugen, Ms. Comer,
Here.
Mr. Madler, and Ms. Bollinger.
He sent an email, he had to be out of town, family funeral.
Thank you, everyone. First order of business is to approve the December 6th, 2021 minutes. And I would ask for a motion.
Move to approve.
Second.
A motion to approve and a second. Any discussion? And then we will, all in favor?
Aye.
Aye.
All opposed? Motion passed. The next order on the agenda is to welcome the new board members. And this is our first board meeting, zone board meeting of 2022. So I thought it would just take a minute to offer a time for everybody to do an introductions of themselves. I am Gail Bollinger. I started last week as the zone director on Monday. And I'm excited to be here and work with all of you moving forward. I'll have you, Julie.
Great, thanks, Gail. I'm Julie Haugen. I'm the Chief Operating Officer at YWCA Cass Clay here in Fargo. I worked at YWCA for about 8 years, and prior to that, I worked at Dakota Medical Foundation for 10 years. So I'm glad to be a part of the group.
Brian Hagan, I've been on the board here since '96. Got off a couple times for a short stint, but it's great to be back on the board, and I'd like to see the transition, what's going on and stuff like that, so this is awesome. I'm currently working the banking business, been in banking for 40-some years, so I should retire someday, so anyway, that's it.
I'm Carrie Fry, and I am the Workforce Center Manager at Job Service in Fargo. I've been there for 21 years. I'm happy to be here, and I've worked professionally with Cass County Services for 21 years. So.
Rick Steen, Cass County Commission, current chair of the commission. I've been on the commission for 7 years. So I've been on this board for 7 years as well. And retired, was a partner with Eide Bailey for 38 years with Eide Bailey. So glad to be here.
Good afternoon. I'm the second commissioner on the board. I'm starting my 4th year as a board member and as a member of the county commission. I'm a retired attorney. I've served 40-some years with the firm of Onstead Twitchell in West Fargo. There.
Any questions? Anything
A
else?
couple online.
Oh, yeah, that's right. Thank you. Michelle?
Hi, good morning or good afternoon. My name is Michelle, and I'm really pleased to be part of the team. And I think that you should be really glad that I am not with you today because I am in Arizona quarantining with a positive test result. But in any event, I'm a private sector employment and HR attorney with some public sector experience under my belt. I have a passion for the child welfare system. I am a former foster parent and an adoptive parent, and was really thrilled about the invitation to join this board. So thank you very much, and I look forward to working with you all.
Thank you, Michelle. Any other questions? I will move on to the next order of business, and that is Kristen Hosbargen with DHS is on, and she is going to provide an overview of the onboarding and an overview from DHS. Hi, Kristen.
Hello, can you hear me?
Yep.
Yes.
Yes.
Great. Well, nice to be with you today. It's from the sounds of it, I'm glad I'm not in Fargo due to the weather. It's actually still sunny in Wapaton. So just wanted to welcome Gail as well as the new zone board members. It's exciting times in Cass for the Human Service Zone, and glad to see Kim Jacobson there as well to assist in the transition. But really just wanted to provide the board with an update, an overview of what we do for onboarding for new zone directors. I think the department as well as other zones have talked about the need for more support and training for new directors that start, specifically when they have not come up through the ranks of social services. So that has been one of my charges as the director of zone operations with the department, is to make sure that we have the materials and kind of a format for what that will look like. To let the board know and remind them, we had 3 new directors start in January. So Gail, obviously last week, Christy Frederick started at Ward County Human Service Zone in Minot, and then Antoine Pickett started in Grand Forks. And so 3 new directors, and think that there will be some value in doing some joint training with the 3 of them. I think we learn from each other, ask questions, that sort of thing. We have our first session already scheduled for, I believe, tomorrow, if not this week sometime. But wanted to show you the document, if I can take control of the screen, if that's okay, Gail.
Sure. How do we do that? I think, yeah, I was gonna say, I think. There you go.
All right, can you see my screen here?
A little small.
Can you
make
blow it up?
Absolutely. Okay, so let me get back to the top. Really, we looked at what are some of the essential functions. I think particular to Cass, we are excited that Lynn and Kim can continue with some of the transition, really with issues specific to Cass County, including processes, how are things done within that local county. So again, this is not really in any sort of, it flows a general timeline. Obviously, your initial contact, doing things with the county, meeting the staff, that sort of thing is what's going to happen at a local level. Those are the first and top priority things. Then when we go on, we're going to look at assigning a mentor for Gail. Although I would say she has 2 with both Kim and Lynn. We haven't done the official assignment of that, but that's, I think, important so that Gail has someone to reach out to, as well as myself, just to say, am I doing this right? Where, who do I call if I have a further question, that sort of thing. Some of this probably is all occurring when she's meeting her local county partners. Then we're going to go through and have Gail spend some time with the DHS Zone Human Resource Manager, which is Alicia Bauman. And so I believe that Gail has had the opportunity to meet Alicia and done some work with her already. But we'll go through really the differences regarding the merit system and some of the uniquenesses that maybe other county departments don't have. And knowing that you have a very active and experienced HR person in Cass, that is a huge support as well. So we go through and do the human resources, then there will be a fiscal portion of training. Laurel Zane, who was our DHS program accountant, has left, and so we're looking to fill this position, but we'll reach out. Along with that, some of these are new information, countywide cost allocation plans. I'll do an intro to some of the human service zone issues. This got a little messy, sorry about that. Also setting up times with Sarah Stolt, as well as our program leads, Corey Peterson, Caprice Knapp, Michelle G, and Chris Jones, really the core programs that Human Services work with. And then making sure we do an announcement and introduction to other community partners, really trying to capitalize on things that we know are important for a successful zone director. And really, if there's things that Gail identifies as we go through this, for her to say, boy, I need to know how to do this It might not be me giving that training, but helping her find that resource. We really want to see a successful transition. So certainly it won't be hours and hours spent with me, but I think we will see a lot of time with each other, and I can certainly do that in person, but we're going to kick off some of the training virtually, like I said, with the 3 new zone directors. So very, very brief overview, but initially when we were looking at Cass getting this position posted, we talked a lot about the onboarding of this new zone director and making sure that that training was there and support, so that they have the best resources to make sure they are successful.
Kristen, does anybody have any questions for Kristen? Appreciate you taking the time, and we will see you tomorrow morning, I believe, right?
Okay,
Bright and early.
sounds great, Gail. Thanks, everyone.
Thank you, Kristen.
Yep, thanks, Robert.
Next on our agenda is the election of a vice chair for our board. It is my understanding I serve as the chair of the board, so I am looking for a vice chair to serve. And is there any discussion or somebody willing to serve in that role? In that role, my understanding, I might defer to Kim to provide a little bit, but in the absence, would serve it in the absence of my being here, do the work with the annual performance evaluation of the director and be a point of contact. Do you have anything, Kim, that you might share further?
I believe like each year, typically in November or December, there's an annual performance evaluation of the zone director. That is a collaborative process between the department. It's a self-evaluation. In addition, the Department of Human Services provides feedback regarding the director's performance, and then the final document is brought to the zone board to add their further comment and to develop an overall ranking. So a vice chair is needed in order to support that process. They would serve as the point of contact with the department to facilitate that discussion back and forth and to make sure that performance evaluation gets completed successfully by the board as well.
Mr. Steve?
I was going to suggest, Brian, you've got more experience than any of us on this board. Would you be at all interested in being vice chair?
No, I chaired it for a few years, 2 years ago. Yeah, no, I would, and I've been through that,
Any other discussion?
somebody else wants to,
I'm going to second Mr. Steen's motion that we elect Mr. Hagan as the vice chair.
Any discussion? If no further discussion, I believe I need all those in favor of the motion to have Mr. Hagan serve as vice chair?
Aye.
Aye.
All those opposed? Motion passed. Thank you. The next item on the agenda is the appointment of a secretary.
Question. Does the secretary have to be a board member, or can we appoint Blair?
My understanding is the secretary is a board member, but then we can direct or assign a staff member to provide that support.
I'll nominate Commissioner Breitling as secretary.
Does your motion include that I be provided support?
We get to do that. Yes.
I better second that then. Help
Is
Dwayne
there
out.
any discussion? Hearing no discussion, I will call for a vote. All those in favor of Commissioner Breitling serving as secretary, say aye.
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 Not in favor, same sign. Motion pass.
Do we need to take action now to designate Blair as the actual reporter?
Scrivener?
I would suggest that we can designate out of the administrative office of the zone, so
Okay.
not specifically but an administrator, administrative assistant,
Perfect. Right.
signed as the assistant.
Scrivener.
Yes, on that. Do I need a second for that? Is there a second? What, can I make a motion?
Chairs can, it's not
Chairs
typical,
can.
but chairs can make a motion under Robert's rules.
Thank you. I'm learning this. All those in favor?
Aye.
Aye.
All those opposed? Motion passed. Thank you. And eighth on our agenda is the Human Service Zone on-call policy. And that was included in your packet, provided. And I believe the Human Service Zone on-call policy, it says draft on, but that is the unified, that should not say draft on it. It was this sheet. That is the unified human resource policy that was official on January 1st of 2022. So that is the on-call policy. And then there is the Human Service Zone on-call procedure that was included. That is the draft. That was, that will be the addendum to our Human Service Unified Policy. Is there any questions? I might have Kim provide a little direction in that since it's very new. Do you mind providing some updates?
Certainly. Collectively, human service zones across the state were seeking a way to help compensate team members who served child welfare on-call duties. We had 19 different zones and at least 19 different variations on how this was handled. And with this, a unified policy was developed, and that allows for the primary on-call worker to be compensated $50 per day that they serve on-call per month. And so there can be individualized approach at the human service zone level on how that's assigned. Therefore, that's the proposed addendum, would be the local policy on how it would be implemented. It is a direct fund budget item, meaning that we will obtain state dollars to help compensate the cost of this item, and our budgets will be adjusted to reflect the provision of this service. So with that, the Human Service Zone did consult our case management supervisors, and I see we have two in the room today, that aided with the drafting of what the local on-call policy or procedure would look like for the Cass Human Service Zone. So that's what's before you today for your consideration.
You know, I did read through it, but what's the typical calls? Child abuse, picking up kids late at night? I mean, what are the top 3, 4 main items that you'd be called for?
I'm gonna give an anticipated guideline, and then if Carissa and Tammy, if you have additional feedback, that'd be welcomed. Typically, it's concerns about child abuse or neglect, urgent reports that come in overnight, children left on alone, children in need of service that are in an emergent situation during after hours. Another example could be you may have a foster child that maybe broke their arm or had an injury that they would need some type of custodial response. Another example would be a child that's in foster care that would be having an emergency, might be at risk of losing their placement or being disrupted in their placement, and they need the services of the local zone to help stabilize the situation or to come up with a contingency plan for the best interests of the child. How did I do? Good.
And so it's just children, not like vulnerable adults.
That is correct.
And how many individuals are on call at one time?
This provision calls for, they're giving me some hand signals. There's one person, so compensation is for the primary, which would be the one individual. If others would be called in, then typical pay would occur with that regarding either comp time, overtime, or standard pay. The $50 on-call pay is limited just to that primary individual.
Thank you, Kim. Any other questions?
in reading the proposed procedure, the only part I thought might be difficult to evaluate was the OCW must respond within a reasonable time. But I'm sure that's hard to quantify and figure out, but if you're the person evaluating that person, that might be difficult. That was my only thought.
Would either one of you be able to address how that's done?
No, in drafting this, we kind of went with what the state policy said, and they
Okay.
said reasonable time, knowing that we have several workers who live in various locations, and so it might take somebody who lives in Fargo, then, much less time than somebody who lives, out of town or whatever, so that's why it's that big.
That big.
But responsiveness is expected.
Right.
That's an accountability factor within the position. And if not, it would yield some type of redirection or disciplinary action if there was a problem.
Thank you.
Any other questions? Not hearing any other questions, I believe we need a motion to add this addendum to our CAS Human Service Zone Policy Addendum.
So moved.
I'll second.
Any other discussion? All those in favor, say aye.
Aye.
Opposed, same sign. Motion pass. Thank you. Thank you. Discussion, our next item on the agenda is a discussion of future operations report. I know there was an operations report included in your packet, and I believe that's how it's always been done, and there might be some things missing out of this operations report, but I wanted to bring up some thoughts about maybe doing quarterly operations report more holistically, but then on the other months to bring expertise from within the divisions to talk about their divisions, their programs. I know that was one thing in the onboarding early on that Robert had some meetings that might be helpful. And we could have somebody from foster care, we could have somebody from economic assistance come and talk about their programs and have some general discussion. So then we all would have a better understanding of numbers and things moving forward. Is there other ideas or thoughts that I'd be happy to entertain, Commissioner?
I think that'd be a great idea, Gail. One thing I was thinking of here before you brought that up was, the changeover from what I see as the old board versus the new board responsibility. When you bring the expertise to the board, one thing I'm looking forward to hearing about is what's not working. What can we help improve? Not everything is good, everything's kosher, here's what we're doing. I would know where do we need help as an agency? Where do we need help to help our constituents, our people, our clients out there? So if that, the off periods, or even on the, the quarterly, it'd be nice to hear that. Because I look at this board's responsibility as advocacy at this point. And so unless we know what's not working, it's gonna be difficult for us to advocate for something. So I want to add that to the piece there, that'd be great.
Other thoughts?
Just one more thought. There was a time too where we would go meet with that department. We could sit there with managers or whoever wanted to join, and you could have a sign-up sheet, would obviously have to show up. But I mean, like right after the meeting, when maybe we took another hour, visit with staff and just let them tell us what's going on, like Rick said, what's working, what's not working, and that seemed to be a pretty good deal. And some of our supporting members, whether it's the YWCA, we used to have meet with them, from time, just to understand out at your place, whoever wanted to do that, but to really understand your function in the community and how you're really helping and stuff, what's working, what's not working.
Maybe some of the collaborations
Right,
between
yes.
The zone, the Cass County
Right.
Human Service Zone, and our outside partners and collaborators. One question that pops into my mind that I'll just throw out there, I'm not sure how many zone members have, board members have been over to maybe a tour of the area.
That'd be good.
Then it could be right after.
I think that'd be great, you know, as Commissioner Steen said, it's more, now it seems the board is now, you're collecting input from the community, getting feedback on improvements. And so, you know, our team, if we were to visit with our team and your team, you know, we would identify things where we could make improvements together, hopefully. So we'd love, I mean, I just would love the outlet to be able to do that.
Very helpful in making a plan that works for the board and provides that education component and can bring it back. I can bring it back to the different divisions as well and come up with a plan moving forward.
I got one more question, excuse me. On your statistics, I think it'd still be good to see those monthly, the numbers. Because then you can kind of get a trend if something's jumping off the page. Why is it jumping off the page? And I know there was some more dialogue in here on the stats, which is great. You know, and I think as we learn how these operations really work, I mean, you know, from a board perspective, it'd be helpful.
Just, Gail, your comment about having some type of tour over there, I think was great. Just would ask, just you said suggested after this meeting. Typically, it would be see if you can coordinate with Robert or find out what else we've got. Commissioners have scheduled. Because sometimes we have back to back, sometimes we don't. So just a heads up on that. Yep, right.
Our end, we can be super flexible to accommodate the group.
This is a question about the operation that was included. One of the very last items talks about the fact that Cass County manages nearly 36% of all child care assistance programs, cases in North Dakota, and authorizes 37.5% of the program funds. Now, can you explain to me how we have only 24% of the population, such a large number of these types of cases? I'm just curious.
Part of it has to do with the demographics of Cass County. You have a tendency to have a younger population base than some parts of the state. Some of our other more rural areas have a more elderly population as their primary. You also have a number of universities and other entities that bring in families to the community. So that likely impacts, you know, the number of potential applicants that you would have in any one community. So without digging it into further, that would be kind of my speculation on what would be the driving forces.
Cass County is in the top 5 for having the largest job opening. There's about 6,000 students, a little under every month for the last year. So there's a lot of opportunities to work with a lot more movement out there. Not enough childcare.
Well, and there's probably more childcare facilities in this part of the state as well, which would also drive the need for assistance and more formalized childcare when I speak of that versus more.
So a question about that. So since we have that much of a higher percent of the dollars being spent here and families being served, do we have that much more employees to serve in that department than you?
That's a good question.
So the number of positions is based on caseload, and so that is whenever there's an opening within the zone for a position, we have to, first of all, ask our colleagues across the state if there's capacity internally within the zones to fill, and if there's not, then we direct the statistics forward to a hiring committee that consists of both zone and DHS personnel that look at the need and look at caseload, and then they make determinations. So, I have never seen a CAS economic assistance position denied when there's been an opening.
Thank you. I was gonna bring up that there's probably more people working maybe than in some other parts of the state too, because of the high demand for
Do we ever see
workers.
stats like that, like compare those numbers of how many employees we have here versus other parts of the other counties in terms of the numbers of people served?
There is some information available to that based on individual program, probably not. Because some staff are multi-program workers versus, being specifically like a TANF worker or a childcare worker. But we do track the number of FTEs across the state by program type. And as we move forward with economic assistance redesign, that will be even more illustrated as we move forward.
All right, one more question, please. One of the things over the years that has been, I don't know, challenging for board members, would like to know as far as how do these people qualify for those types of benefits? I mean, it'd be nice to know, so if I applied for, I don't know, childcare or, I mean, how do you qualify for that? I mean, what are the thresholds? And, I know there's different programs out there. It'd be nice to have I don't know, some type of website where it's out there, but you could just direct us to that. But how do you qualify? Economic assistance, we've been asking that for quite a while. So just as a thought, because people ask us in the community, how would I get, if someone's disabled or if someone's, I don't know, got some challenges, how do you get health care? How do you get food assistance? I mean, all of those SNAP or whatever. So just a thought.
There is a website.
Okay.
And there, of course, are numbers to call. But just, every program has its own unique
Yes.
qualifications and requirements. So there isn't just like a master little list. We can keep every program
Okay.
is different. And so, but that could certainly be a report that the economic assistance team could provide
That's what
and try to drive some meaning to that. For
And
the board.
just teach us how that really works, or how do you,
I think that's a good point, and that's kind of what I was
Yeah.
thinking of,
Yeah.
every program is unique in its qualifications and all of that.
right?
But as a community member, how would I direct a person and where I could go? I think that would be great information to share, and then you could share that moving forward too. So,
As a suggestion, if you're having that discussion, it might be also helpful to have those groups address what efforts regarding program integrity are in place, the different safety nets and checks and balances that are in place, that are tools that are available to that unit in order to make sure we're making accurate determinations.
other discussions or things that this board would find useful at these meetings?
One item, kind of to address the elephant in the room without going into details. Most of us are aware of the fact there's some investigations going on with regard to some management people, not that I don't want the details, but at what point or what level of involvement this board will be asked to participate in it. And
If the items would be, if there'd be any action taken that would rise to the level of an appeal to the Human Service Zone Board, that's the point that this board would be involved.
in the timelines, is there any time frame that you could provide to this board as far as where we're at with things and what it might rise to that level, if it does at all?
Whenever there's any type of investigation, there's a timeline associated with that. And then there needs to be a recommendation made, any type of determination that would need to be made if there's regarding any further action, whether it's returning individuals back to the workplace, whether it would be any type of disciplinary action or the like. If there is any action taken against the employee, that would be disciplinary. There's a pre-action step, which then has a timeline for the individual to respond. And then the agency has the right to respond again. And so there are multiple steps before it would get to the board, is what I'm indicating. So if we said everything was done today, for example, there would be probably 30 to 45 days minimally before it would reach the level of a board if it was a
I'm familiar with all that, I just didn't know if the board members understood where we're at with things.
Mhm.
This board gets involved and that type of thing, so I just want to make sure they're aware of that.
And the board asked, what is your time frame on those 3 positions, or 4 positions now? Like, is that okay for the board to ask? Or how long will it be before they're stated, or?
As you were describing, I was like, would it be appropriate to at least have the positions and the stage of the process?
I can say the positions. Children and Family Services Division Manager, Child Protective Services Supervisor, Child Protective Services Supervisor, and then most recently, the Economic Assistance Division Manager. The first three were result of an earlier grievance. The second, the Economic Assistance one was a more recent grievance.
But as far as this board, when we meet, are we able to the point about kind of where we're at without knowing the specific details, just to know this, what part of the process folks are in? As you said, there's many steps. Is that appropriate?
The Children and Family Services related grievance, we're at the point of being close to report finalization and determining next steps. The Economic Assistance one is in the early investigative stages. Anything further?
Nothing from me.
Thank you, Kim.
Yep.
Any other questions? Any other discussion points on future operations? Hearing none, I will take that back to my desk and hopefully develop a plan moving forward for that. Any other items? Otherwise, we're close to adjournment. No other items for the board. I will call for an adjournment.
Second.
All in favor?
All right.
All opposed? And our next meeting will be, I should have brought that up, the 7th of February, back to the first Monday of the month at 1.